our 2021 Fall Prevention Awareness Month. And so this month, every Tuesday, we are going to um, have a different presentation that relates to fall prevention. So I hope that this information you find it relatable to you, or perhaps you have a family member that could be at risk of falls, or just something to think that you can think about. So my name is Erica Thompson. I am a health educator for aging and adult services. I have been in my position for about 8 years, and I coordinate a couple of health education programs. The number one is Stepping On, which is our fall prevention program, and the self-management programs to manage chronic conditions. And recently, I became an instructor for the Dementia Dialogues program, or no, dealing with dementia, and also um, stepping up your nutrition. So I'm excited that we'll be offering those two new programs now. Okay, so kind of moving on to our topic of fall prevention. Yeah. Uh, So why should we be concerned about falls? Well, falls, many people think that falls are part of aging, that are not preventable, and this is a myth. Falls should not be part of aging. There is a lot of things that you can do to prevent falls or to reduce your risk of falling. So falls, falls in itself are not important, but preventing falls is what's important. This is because falls are the leading cause on, yes, somebody just wrote in there, they don't want to be found naked in the shower uh, because they are unconscious. Right, that's a good point. But also because falls are the leading cause of fatal and non-fatal injuries for older adults. 1 in 4 older adults fall every day. And every 11 seconds, an older adult is treated in an emergency room for a fall. As you know, falls can have serious injuries, like a broken hip, a broken bone, a head injury, and this resulting on very long periods of recovery. But also, they can be very expensive. The average hospital cost for a fall injury is over $30,000. And not only that, I guess, one of the important things about it is that uh, it can have a real burden on your quality of life. Some people that had had maybe a minor fall develop a fear of falling, and these can cause them to have a physical decline, depression, social isolation, and feeling of hopelessness. So, because they really don't want to be out there if they're gonna fall, so they just kind of keep to themselves, keep at home, but to prevent falls. But this actually has opposite results of staying home doesn't help them. And falls can also impact caregivers. We often don't think about the caregivers and the impacts they're having. But when you have a female or a male caring for a loved one, they can develop um, feelings of like feel depression. They have a burden for caring for somebody, and these things can contribute to caregivers to have a fall. But the good news, like I mentioned earlier, falls. can be preventable, and older adults can improve their balance and strength to prevent falls. Okay, so I did mention caregivers, and so 1 in 5 caregivers report high levels of physical strain, and this is because of their caregiver duties. They spend a lot of time caring for that one person, and therefore caregivers kind of maybe neglect themselves because they can't find time to do anything else. And so to for caregivers to avoid falling, they need to increase their physical activity so that they can keep with their strength and their energy and their muscles and bones strong. Caregivers also need more information as to how to care for somebody and what resources are available for them. And b- caregivers also feel like they don't have enough guidance or information on topics related to caregiving, and so they feel a bit of inadequate and when they're caring for someone. And if they had this information and these resources available, then they can keep their family member at home safe, which is the goal for every caregiver, just to have that family member being at home, independent, um, and so that's why they take care of them. And then because of these things, the caregivers can have a increased risk of falling, but also the care recipient could be at risk of falling. And this is because when you are caring for someone that needs help with their activities of daily living, like getting in and out of the bed or getting out of a couch or a chair, the caregiver needs to assist, and sometimes it can uh, the, turn into a fall. And so that's why we need to keep in mind caregivers when we're talking about falls prevention. Okay, so there are a few risk factors that we need to consider when we're trying to prevent falls. We have the physical risk factors. These ones are changes in your body that increase your risk for fall. So, for example, you develop cataracts and now you're having a really hard time seeing, or you develop any other eye condition, um, these can put you in a higher risk of falling. Or you develop arthritis and maybe on your knees or on your feet, and because of the pain and the discomfort, you decide not to exercise. And so that puts you develop a risk of falling because of your physical limitations. Then we have the behavioral risk factors. These are the things that we do or we don't do that can increase our risk of falls. So, for example, not engaging in physical activity, that's a decision that we've made. I'm not going to exercise because I don't like it or because I have pain or because I don't know where to start or where to go. That can put us, that's a behavior risk factor. Or another one is deciding not to take your medications um, that you need. That can put you in another, risk. Then we have the environmental risk factors. These ones are hazards in your community or in your home. So an example of a hazard in your home is having clutter in your hallways, or maybe not having a handrail on your steps. So you have to kind of hold on to the wall to go up and down the stairs. And a community hazard can be um, having to cross a very busy intersection that has a lot of cars and traffic and is confusing. Or the one that I find in my neighborhood every time that I go walk my dog is the walkways or the sidewalks. They are uneven and um, my shoes get caught on some of them because they need repair or things like that. So those are environmental factors that put you at risk of falling. So there are some of those risk factors that we can be proactive and change them, like the physical activity. We can. The example I gave you was to develop cataracts. So this one we can be proactive and go have cataract surgery, and that kind of takes care of that risk factor. There are some others that we are not able to control, like I was telling you, a very busy intersection that has a lot of traffic and a lot of cars. That one we can't really control, but we can um, come up with another way to cross the street and maybe find another light, another traffic light to cross the street. So we kind of need to be aware of these risk factors to reduce our falls. Okay. And then there are some things that you need to look at to prevent falls. So as we age, most of us lose some strength, coordination, flexibility, and balance because of inactivity. And so this makes it easier for us to fall. Then we have vision. Again, as we age, we develop eye conditions. We don't get as much light in our eyes, it, which makes it really hard for us to see like contrasting edges or tripping hazards and obstacles, in the home or outside in our surroundings. Medications, you know, um, individuals that take four or more medications are at higher risk of falling. But if you add to these prescription medications, over the counter medications, then you kind of doubling your risk of falls. And this is because of the interactions that these medications have with each other. You don't know if cough syrup that you picked up at the pharmacy is going to have an interaction with your prescription medicines. And so some of them can cause dizziness, sleepiness, dehydration, or any other interaction that could lead to a fall. So that's why it's very important that you have a medication list, that you consult with your medical health provider or your pharmacist when you're trying to stop taking a medication or you're gonna take something from over the counter so that they can see if there are any possible interactions that could put you at harm. Then we have the environment. Those are modifications that you can do in the home to help you stay safe. And some of them are reduce the clutter, make sure that you don't have any boxes or kind of things on the hallways that you can trip. Uh, Also, lights, that you have enough um, light all over your home, that you can reduce any rugs, anything that's going to make you trip, and having handrails, in the hallways, in the bathroom, everywhere where that you need an extra boost or that you feel unsteady so that you can be more steady. And then chronic conditions, the more chronic conditions you have, the more you are at risk of fall. So diabetes, heart disease, and arthritis can put you at risk of fall because they result on lost function inactivity, depression, pain, and can lead to having to take more than two medications. And remember, I said if you take more than four uh, prescribed medications, your risk of falling increases. Okay. Mm. So I have a few steps for how to start coming up with an action plan to reduce those falls. Make sure that you stay strong. And the first one is to rea or figure out if it's time to start talking about fall prevention, whether with a family member or a healthcare provider or a friend or someone. So I have these questions here in the screen, and I like it if that you take a piece of paper and a pen out, and we are gonna go through each one of these questions. We're gonna figure out if you are at risk of falls and if you need to start thinking about some changes that you need to make. So these questions are really easy. There's either yes or no answer. Uh, and depending on the question, you give yourself a point if you answer yes. So the first question is, I have fallen in the past. Yes or no? If you say yes, give yourself 2 points. The next question, I can or have been advised to use a cane or a walker or to get around safely. Yes or no? If you give yourself a yes, you need to give yourself another 2 points. Next question is, sometimes I feel unsteady when I am walking. Yes or no? If you answer to this yes, you give yourself 1 point. Okay, next one. I steady myself by holding on to furniture when walking at home. Yes and no. If you answer yes, give yourself 1 point. And the next question here is, I am worried about falling. And again, yes or no. And if you give yourself a yes, add one more point. Okay. I can't see you guys, but okay. So we are going to go on to the next questions. Ready? There's more questions. But before we go, maybe you can add your points. So here's the next questions. I need to push with my hands to stand up from the chair. Yes or no? If you answer yes, you get to have 1 point. Um, Next question. I have trouble stepping up onto the curb. Yes or no? If you answer yes, you have 1 point. Uh, Next question. I often have to rush to the toilet. Yes or no? Yes is 1 point. I have lost some feelings in my feet. Yes or no? And yes is 1 point. I take medicine that sometimes makes me feel lightheaded or more tired than usual. 1 point if you answer yes. I take medicine to help me sleep or improve my mood. 1 point if you answer yes. And last one is, I often feel sad or depressed. 1 point if you answer yes. So this quiz is one of those ones that you don't want to have 100%. This quiz is one of those that you want to have the least amount of points. So, like it says on the screen, if you score 4 points or more, then you might be at risk of falling. And I wanted dare to ask, did anybody score more than 4 points? I only see one person nodding. Maybe I should ask the other way. Did anybody score 0 points? We have we have a quiet bunch. Okay. So this was your first step. So if you score more than 4 points, uh, this means that it's time for you uh, to do something to prevent falls. Uh, so this is the kind of like the next thing that you can do to prevent falls. Step two is to talk about fall prevention with somebody. Okay, so somebody got that 2 points. That's that's okay. Thank you for sharing. So whether yourself you're feeling like you need to do something about falls, or maybe you have your parents and you notice some of those things that we kind of went over on this quiz, then it will be good to talk to somebody about preventing falls. Before you go ahead and have that conversation, you need to be aware that for some other adults, acknowledging that they are at risk of falling, it's it's hard. This is because um, people, seem to think that falls is part of aging, and because you're getting old, you have to have a fall, and this is a myth. But some people really take it take it to heart. So you really need to put some thought and some time into this conversation before you approach somebody uh, about about falls. So some ideas is you can use I statements like I am concerned about your fall, about your balance, because I don't want you to fall. You need to be considerate of the language you use. I am worried about you and I want to help. So whenever you feel like you need to have this type of conversation with somebody, you need to approach it as a safety concern so that they can be more open to have this conversation. So be mindful about how you describe the changes that you have noticed that can pose a risk for falling. So you can, if you notice that this person is having a hard time getting out of the bed, you can say, I noticed that you're having a hard time getting out of the bed. Um, is there something that we can do to help you? Or have you noticed this yourself? Yeah. Also, you need to be clear about how you all you want is the person's overall safety. We need to be mindful about our tone, our body language, and understand how this person communicates, the person that you're approaching about falls. Um, and we also need to recognize that talking about falls is not a one-time conversation. This is something that can take you several conversations. That person might not be ready to have a talk about falls, but maybe a couple months from now, this person is ready. So we just need to um, try to have it at different times. And And then if you can also, if you wanna approach your doctor but you have some hesitation, then you can pair it with a going out to lunch, doing a fun activity, so that when you go to your doctor, you're more relaxed, you're more willing. It's not, oh, I have something that you dread. Like, oh, I have to go to the doctor and talk about falls. Kind of like give yourself a reward for having that talk with your healthcare provider or with that family member. And then also be open to find resources or changing your plans. Because this is not an easy conversation to have. So once you have that conversation, then you need to develop a fall prevention plan. So this one you need to enlist support. This is something that requires many people to be engaged in this. You have your healthcare provider, your pharmacist, your eye doctor, a physical therapist, an occupational therapist, family members, um, a friend, a neighbor. So many resources, they all have to be involved so that you can be able to take these steps. You also need to talk about your current health conditions with your healthcare provider, especially if you have more than three health conditions, just so that you make sure that you're all on the same page concerning how you're going to take care of those conditions and the medications that you'll be taking. Uh, Also, make sure that you have an eye exam. So it kind of depends on everybody and uh, on your health condition, and also depends on your health insurance. I heard some people that said that they have to have eye exams every 2 years. Other people need to have eye exams every year. I myself, for a while, needed to have them every 6 months. So it just kind of depends on the person and the recommendation of your eye doctor. But make sure that you don't miss that. And if you put it off, so make sure that you um, schedule an eye checkup as soon as possible. When we talk about moving around the home, not only getting rid of all the clutter, but also notice if the person that you care for, your mom, your dad, your grandma, or yourself, if you're moving around the home by holding on to walls or holding on to furniture, or if you have to grab somebody's arm to move around in your home or out in the community, then this is a sign that you need to do approach this topic. And then talk about your medications. And once again, your healthcare provider, but your pharmacist is part of your healthcare team, and they have a wealth of information about medications and side effects. And I also think, or is my perception based on my pharmacist, that they have a little bit more time uh, to spend time talking about those medications. So it's good to reach out to them. So once you have your fall prevention action plan, then you can engage some resources in the community, and this is kind of where Salt Lake County Aging and Adult Services can jump in and assist you. We have several health education programs that provide a lot of really good information and that can help you prevent. So the first thing you want to do is you want to do a walkthrough safety assessment of the home, and we have two programs that could help you accomplish that. Stepping on, like I mentioned before, is a fall prevention program that we cover how to assess your home so that is you can reduce your risk of falling in the home, and the aging mastery program. This one is not a fall prevention program, but it does cover fall prevention, and it has a lot of other wonderful information like sleep, and physical activity, and fall prevention, and retirement, and a few other great topics. The next action step is find an appropriate community-based fall prevention program. So to prevent falls, you have to use it or lose it. That's kind of like if you don't use your body, develop those muscles and the strength, then you're more likely to have falls. And also, you lose your balance, but you can regain it. And the programs that are listed here can help you with that. We have Arthritis Foundation Exercise Program, Tai Chi for Arthritis, Enhanced Fitness, and Walk with Ease. And all of these programs are offered at the Salt Lake County Senior Centers, and some air some and they're offered across the state. That's what I want to say. And they are for any fitness level, whether you are a beginner to, you know, physical activity, or you are hardcore, really love to exercise, you can join any of these programs. Then, another option is that if you are a caregiver, we did mention a little bit how we need to be aware of caregivers because they also caring for somebody, but maybe they are putting their needs aside. And so it's important that you find support if you are in this role of caregiving. And we have four programs that could help you uh, find not only information but support that is always needed for when you're caring for someone. So we have the stress busting for family caregivers, and this one is they have two versions. If you have a chronic condition or if you're caring for someone with dementia, caregiving talking points, dementia dialogues, and dealing with dementia. So you say, how do I sign up or how do I find out more about these programs? Well, the state has this wonderful website. It's called livingwellutahgov. And at the top, it says find a workshop. If you click on that, then it has this view here. And then if you click on program, it will have a drop down menu where it has all the programs listed. You can search by zip code, or you don't even have to put zip code. You can just click search and it gives you all the programs. If you're looking for a specific program, maybe I didn't mention that. These explore workshops, that one has all the information about all the programs that are available. Um, I didn't mention all the programs that I mentioned and the additional programs that are listed on this website. They are free for everyone who lives in the state of Utah. Okay. In addition to that, we have, let's say that you like, oh, I am not ready to go to a senior center, um, which is understandable. Well, we have these healthy at home webinars that you are all here every Tuesday at 2. Then we also have a YouTube channel where we have a lot of exercise videos, and that can be just the one step that you can take to get you into doing physical activity, from the comfort of your home. Not only our YouTube channel has a lot of them, but many other people have put in their other exercise programs. So this is how I started exercising. I found a one program there in YouTube, and I worked on it for many months. And then when I felt like I needed to move to something with more intensity, then I found some other program in YouTube, and then I just did it there at home. So that's another way to do it. And then the last is the virtual senior center classes, and I have this the website there on the screen. But there is also a lot of classes available online that could help you reduce your risk of falls. So I'm gonna open it up for you guys to see if you have any questions, comments.